This presentation is for Journal Club number 1. The paper that I chose, the title was Selenium Supplementation Could Restore Euthyroidism in Subclinical Hypothyroid Patients with Autoimmune Thyroiditis. This was a randomized controlled trial. The population was autoimmune thyroiditis and mild subclinical hypothyroid patients. The exposure was oral selenomethionine treatment. The comparison was not receiving it. The outcome was thyroid function assessment, including TSH levels. The setting was the Endocrine and Metabolic Unit, Department of Medical and Surgical Sciences at the University of Brescia, Italy. This study took place between October 2013 and November 2014. The inclusion criteria was 18 to 65 years old, mild subclinical hypothyroidism related to Hashimoto's thyroiditis, and no prior treatment for it. The exclusion criteria was pregnant women, those wanting to become pregnant, and those that had to start thyroid hormone replacement therapy. Are the results of this trial valid? Is there risk of bias? Assignment to patient groups was randomized. Researchers used a block allocation scheme with random block sizes. The article mentions that the treatment and control groups were superimposable for age, gender, thyroid hormone levels, and thyroid peroxidase antibodies at the beginning of the study. This indicates that similar treatment and control groups were utilized. 98 patients were analyzed from the selenium treatment group and 98 from the control group. There was no mention of blinding. The duration of the study was 4 months, which appear to be adequate to see if there are benefits to the selenium supplementation. Here's a flow chart of the study. You can see that they started with 5,677 hypothyroid patients. After applying inclusion and exclusion criteria, they ended up with 98 patients in the supplemented group and also 98 patients in the control group. There were 4 patients who discontinued the intervention. The thyroid function assessment was performed. The supplemented patients was 96 total. Out of the 96, there were 30 that actually responded that had TSH levels less than or equal to 4.5 milliunits per liter, whereas in the control group, there were only 3 responders. Here's a table of the results. TSH was the main outcome measure, followed by thyroid peroxidase antibodies. In the supplement group, responders had TSH levels of 3.21 plus or minus 0.61. Compared to the baseline of 5.88, this indicates a significant treatment effect. The plus or minus 0.61 is a fairly narrow range, so it may be fairly precise. The p-value was less than 0.0001, so this indicates that it is statistically significant since it is less than 0.05. The outcome measures are physiologic and include TSH, free T4, and thyroid peroxidase antibodies. In terms of clinically important outcomes, a TSH level of less than or equal to 4.5 milliunits per liter is considered a responder, and anything above this is considered a non-responder. Also, TPO-AB was also the other physiologic biomarker. It doesn't appear that any adverse events were mentioned. Here is a table of the outcome of TSH. The control event rate was 3.12%. The experimental event rate was 31.25%. The relative risk was 10. The relative risk reduction was 901% more likely to have lower TSH when taking the selenium supplementation as opposed to the control group not taking the selenium supplementation. The absolute risk reduction was 28.13%. The number needed to treat was 3.55, and this is rounded up to 4 since it refers to the number of people. So 4 people would need to be treated with the selenium supplementation in order for one person to see reduced TSH levels. The p-value for TSH in the selenium supplemented patients was less than 0.0001, and the p-value for TSH in the control group is p equals 0.044. Both are statistically significant since they are less than 0.05. Can I apply the results of this trial to my patients? The study indicates that selenium supplementation, specifically 83 micrograms of selenomethionine per day, may lower elevated TSH levels in those with Hashimoto's or subclinical hypothyroidism and improve thyroid peroxidase antibodies. The main point here is that the patient needs to have Hashimoto's or subclinical hypothyroidism diagnosis and not be undergoing treatment. This might be rare to find patients with this. Are the potential benefits worth the possible harms and costs? It seems that not treating Hashimoto's or hypothyroidism with standard of care thyroid hormone replacement therapy could be risky, as it could lead to further damage to the thyroid. Adding selenium supplementation from 50 to 100 micrograms to patients taking thyroid hormone replacement therapy appears to be safe and beneficial for patients, especially those with a selenium deficiency. The clinical bottom line is that selenomethionine supplementation may lower elevated TSH levels in individuals with hypothyroidism and also improve thyroid peroxidase antibodies. These improvements in TSH levels and thyroid peroxidase antibodies only occurred in approximately 31% of patients receiving selenomethionine supplementation, which wasn't the majority, but it was much higher than the control group, which had 3% of participants with improved TSH levels and thyroid peroxidase antibodies. Selenium supplementation using selenomethionine form may be more beneficial than other types of selenium supplements for patients with Hashimoto's or subclinical hypothyroidism. Parts of the paper that aren't relevant to case 3, the setting is different. The patients in this paper were located in Italy, while the case 3 patient resides on the Yakima Reservation in Washington State. The main difference between this paper and the case 3 patient is that this paper studied patients with Hashimoto's thyroiditis or subclinical hypothyroidism that haven't undergone pharmacotherapy, while the case 3 patient has been taking synthetic thyroid hormone medication. Also, pregnant women or those wanting to become pregnant were part of the exclusion criteria in this paper, while the case 3 patient would like to have another child. And this completes my presentation. Thank you.